I did a quick survey of the Pittsburgh market, and what I found was that a new car costs anywhere from $25,000 to $150,000. Why should healthcare be any different?
I think that's a fair question. The difference I would tell you though is the new car that costs anywhere from $25,000 to $150,000. I understand why, and I could find out in painful detail every bit of difference between that $25,000 car and that $150,000 car. I could configure it the way I wanted. I can create the experience, the features, everything I want about that $150,000 car. And I can be confident that that $150,000 car that I bought had some level of incremental value to me above what I paid $25,000 for. I can't do that in healthcare today. And I'll give you a great example. I'm a fisherman. Whenever I go to buy a new fishing rod, which is often, what I always ask is, tell me what I get for the more expensive one. And if they can't tell me, I buy the one that's less expensive. You can't do that in healthcare today. And to me, that's one of the big differences. And whether we like it or not, you guys, consumers are going to demand that of us. And as long as we keep hitting them with the amount of copays and coinsurance and deductibles, as long as their financial responsibility increases, their frustration with not understanding the difference between the $25,000 car or the $150,000 car or the $272 MRI and the $2,700 MRI is what's going to create the level of frustration and angst with our industry that we're seeing today.